In task 2, you're going to present your care plan that you've put together to your teacher, and there are pass, merit and even distinction criteria that will be assessing your communication skills and how you are doing things like preventing or dealing with inhibiting factors, for example, in an evaluation. In your interview for task 1, there is no judgment on your communication skills, but it is an opportunity to perhaps practice. You might want to do a video. Nobody likes being videoed. I don't want to be videoed right now, but it's a good idea to be able to see your own body language, how you say something, and not just what you are saying. So you need to demonstrate respect for the person in front of you because it's all about your person-centred skills. So we're looking at another person's point of view. In your interview, the other person is going to be as uncomfortable or even more so than you are. So it's important to think about how you're going to break down those barriers, inhibiting factors, to make them feel a bit more comfortable. And I think being human and coming across human and sort of reassuring them is your best bet. Your interview, and when you put your one-page profile together or summarise the points of the interview, can be done in unsupervised time, so you don't need to be in front of your teacher for that. But there is a bit of a time limit and you need to get it done to the deadline that your teacher has set for you. So starting out your interview, it would be a good idea to thank the person. When you're looking at respect from their point of view, it's important that you do that. For example, thank you very much for taking your time. I really do appreciate it. This will help me develop my communication skills, which I'll be assessed on later. But also it will help me with my whole unit. So thank you very much for that. You need to explain that through the interview, you'll be needing to make some notes. Your one-page profile is going to come from your memory of the interview and those notes. So they need to be reasonably detailed for you to get that information. In that time, your head will be down and you will be writing. So it's good to have an explanation or reassurance to the person that you're interviewing. So you would say something like, I'm going to be writing down some of the key points of what you're saying, which will take me a little bit of scribbling, bear with, because I want to get it right and I want to get it accurate, because after I put it together, I'm going to be giving it to you, as I've said before, to give your opinion on how accurate it represents you. Thank you for your time for that second meeting as well to give me the feedback. This should be taking perhaps sort of 15 minutes, maybe 20 minutes, but if you don't want to answer a question, that's absolutely fine. We'll just go past that one. You have signed the consent form and you've been kind enough to let me use your name in my coursework, but it will only be me seeing it and my teacher, and anything that happens in this communication, let me reassure you, I won't be telling anybody else. Part of person-centred care, which I am learning about, is about people's confidentiality. So, please be reassured that I am not going to be telling anybody anything about this, because it's personal details that you're giving to me. If you notice any of my communication skills that could be improving, at the end, if you've got 5 minutes, give me some feedback. I'd appreciate that. What you could do is get it recorded. If the other person agrees to it, or you just focus that camera on yourself and are not on them, you can have a look at your own communication skills. Are you looking really nervous? Are you fiddling with your hands? Are you stumbling through your words? Practicing now on your task 1 will help you then in your task 2. It's always a good idea to record your task 2 as well, so that you can do some self-reflection on your own communication skills, as well as the feedback your teacher gives you. It's always worth perhaps making the person feel a bit more comfortable and saying, so, I've got some water here. I've made sure nobody's going to interrupt us, so it should go okay. Is there any questions you'd like to ask? Are you ready to start? Bear in mind that other person's point of view, because that's what person-centred approach is all about. I think you might be ready to start.